So today I wanted to talk to a patient about her experience with sacroiliac joint pain and sacroiliac joint fusions. The sacroiliac joint is right here, and it's the junction in the back of the pelvis where the sacrum meets the ilium. This is called the iliac crest, and that's the big bone of your pelvis, but the joint is called the SI or sacroiliac joint. And it can be painful, and it becomes sometimes arthritic and inflamed. And what we do to diagnose this is certain physical exam findings, and then we will do an injection into the joint with some local anesthetic. If that relieves the pain, that would indicate that that's where the pain's coming from. And along with the physical exam findings, we can make the diagnosis. This patient has had a fusion of the sacroiliac joint on both the left and the right side. So let's talk to our patient. So you were having problems with this for a long time, right?
Yes, sir.
And it affected your ability to do your job, which is pretty physical.
Yes, sir.
So we tried lots of conservative care, medications, physical therapy, and then do you remember having the injection?
Yes.
So when I do the injections, what I do is I have the patient asleep at the hospital with some IV sedation. I put a needle under an x-ray machine into that joint and we inject some local anesthetic. And what we want to know is if the patient feels better during the time when the anesthetic's present, just like when you go to the dentist. And in both instances, this gave her the temporary relief we were looking for. Now you've had the joint fused. How do you feel now?
I feel great.
It's helped you.
Yes, sir.
So I know that you're in the law enforcement area, you're very physical, you have had a background of working ranching and things like that, is that right?
Physical activity.
Yeah. So do you feel like you're going to be able to get back to all of
I
that?
do. I feel great. I'm several months out now, and I feel better than I felt in about a year and a half.
Good.
A year and a couple months.
Well, good. Was the surgery hard to recover from?
No, I was up and moving same day,
Yeah.
and the second one was, I say a little harder, but it was just a couple days where I was in a little bit more pain, but
Yeah.
still mobile and able to take care of myself.
So the surgery to fuse this joint takes just a short period of time, less than an hour, probably 30 minutes. We make a small incision like this over the buttock, and these 3 screws are put across the joint in such a way so that they stimulate a fusion to occur. And the screws are hollow and have open spaces where we put some synthetic material as bone graft. Anyway, thank you for letting me take care of you. I appreciate you.
Thank you, Dr. Graff.
And thank you for doing what you do.
Thank you so much.
You bet.